Anatara Lifesciences ASX ANR on the Australian Stock Exchange is a progressive life sciences company, and with me today is Steve Lydeamore, the Chief Executive Officer. Hey Steve.
Hi Tim.
Now please tell the watchers on the video, who is Anatara?
Yes, Anatara, ASX listed, ANR, focuses on gastrointestinal disease, a high unmet need in humans, and we're focusing on irritable bowel syndrome and inflammatory bowel disease, and we'll talk a little bit about that.
Now, so why did you come to be with Anatara? And what's your history?
Yeah, so I joined Anatara in December of last year, and I've worked for some of the world's leading companies in both Australia and Canada. FH Faulding Company Limited, the largest Australian pharmaceutical company at the time, and Apotex Inc. in Canada, Canada's largest pharmaceutical company. I progressed from finance roles into business development, then executive management. The most recent overseas role was President Aper Biologics, a biosimilar developer, and prior to that I was Executive Vice President and Managing Director of Apotex International, encompassing 113 countries around the world, including many which were focused on consumer health areas, which is important to Anatara.
All right, so talking about consumer health, right now Anatara is addressing irritable bowel syndrome and inflammatory bowel disease, IBS and IBD. Please explain how the Anatara products fit into the treatment of those conditions.
Sure, both of these conditions have a high unmet need. IBS is the most prevalent out of the two, so 11% of the global population have IBS, and in Australia 1 in 5 at any point in their lifetime may have it. High unmet need with some pretty horrible things that go with it, so think of pain and bloating, diarrhoea, constipation, things you don't really want to talk about. People are searching for answers, and unfortunately the remedies and medicines at the moment don't meet their needs, so they're seeking solutions like our product. We're trying to develop from the ground up a scientific, evidence-based product to treat the 3 underlying symptoms of irritable bowel syndrome and inflammatory bowel disease, and that is the microbiome, your gut if you like, being out of balance. We're trying to address that, trying to reduce inflammation and heal the gut lining or the mucosal lining.
In the market, are there any other products doing the same thing as this, or is this?
Mostly in the moment they treat one of the underlying symptoms. So the medicines, the pharmaceutical products in these conditions primarily treat the inflammation, and they concentrate on that. Unfortunately, they don't necessarily work long term, and they also have severe side effects. Most of the other products for IBS in particular focus on treating individual symptoms. So it could be pain, it could be bloating, it could be stomach cramps, diarrhea or constipation. We're trying to make a breakthrough here and disrupt the market by addressing all 3 of those things at the same time.
So, you've had many years of research on the microbiome in other areas besides human health. So this has led to not a pharmaceutical product, but this has led to a very safe human edible product, a dietary supplement almost. Yes,
it will be a dietary supplement. Each of the ingredients that we're using has scientific and clinical or preclinical evidence for their use in our formulation. We're going through a significant process of proving that it works, and we've had great results to date. So back in February we announced proof of concept data that showed that we could stop the pro-inflammatory bacteria attaching to the gut wall and to reduce inflammation. And just recently we had great news. We followed up with studies showing that the genes responsible for mucin production, which are typically down-regulated in both of these disease states, we could up-regulate them, which gives us a great confidence going in that this product could be mucosal healing or repairing the gut lining. We followed up with the in vitro studies with in vivo studies in an animal model, and showed that it works in the animal. So translating from the lab into the mouse gives us great confidence now moving into human clinical studies.
So how do you see what's in terms of the next milestones for the company? I mean, you're obviously addressing an unmet need in human health, but this would have commercial applications globally.
Oh, absolutely. So we have some exciting milestones coming up. So before the end of the calendar year, we're going to put together our licensing package of all the preclinical data with a view to starting the partnering discussions early next calendar year. We should have finalised the protocol for the human clinical trial, which will start in the second quarter of next calendar year. These are specific milestones and very interesting for moving forward with our GaRP product, which is the human health product for IBS and IBD.
And so GaRP is the gastrointestinal reprogramming, which is a very interesting concept.
Yeah, it won't be the brand name, but it's representative of what we're trying to do, and that is to address those three things that I mentioned before, which are the underlying problems with IBS and IBD patients. Microbiome in dysbiosis or unbalance, if you like, inflammation and mucosal damage.
For investors watching, very interesting company, keep an eye on them, Anatara Lifesciences on the Australian Stock Exchange, ANR. Steve, thanks very much for coming in today.
Yeah, thank you, Tim.